Hello, dentalunboxing.com subscriber. It's Dr. Tim Kosinski again, one of the clinical evaluators with dentalunboxing.com. Thank you for joining me today for another dental product unboxing and clinical evaluation. So let's get to it. Today, I'm unboxing and going to clinically evaluate my practice, a product from Directa Dental located in the USA called the Physics Forceps, which are used for atraumatic extractions. Exciting. Let's see what's in here. Atraumatic extractions, that sounds pretty dynamic. We all know that extracting teeth can be challenging, and any product that will make an extraction easier for me makes a lot of sense. Lots of stuff in here, so let's see what we have. We have something green, so let's take a look. We have a box of the Physics Forceps that will come to you, packaged like that in a nice area. And what you're going to find inside of here is a series of 4 instruments called the Physics Forceps. And these instruments are very specifically made for different parts of the mouth: upper left, upper anterior, upper right, and a universal lower. It consists of 2 components. It looks like a forceps with handles, but it's very unique in that it consists of 2 components. A beak, which is a shovel-shaped edge, and a bumper, which was simply providing a center of rotation for the instrument. It has a very unique curve to it. The bumper is a silicone little covering that is very easy to insert into the bumper part. Now I want you to remember, this is not the working end of the instrument. And we will simply use this instrument to what I like to call atraumatically remove teeth. What does that mean? Well, we want to remove teeth without a lot of trauma. We don't want a lot of trauma to the hard tissue. Bone is gold to us. We don't want to damage or break or fracture a good viable bone, because it makes grafting easier. It makes eventual implant placement, if you so choose, much easier. It's also atraumatic to the patient because you're never squeezing the instrument. We're not squeezing, we're not putting a lot of force on it. Rather, we're going to create tension on the lingual or palatal aspect of the tooth with the beak positioned 1 to 3 millimeters subgingival, and you're going to place the bumper as high up or as down low the vestibule as possible. Remember, the bumper is not the working end of the instrument. It's not intended to hold the facial plate of bone. It's simply intended to act as a center of rotation for the beak to disengage the tooth up and out of the socket. This little bit of tension, and I can do this with 2 fingers. I'm simply rotating my wrist. Which will create tension on the lingual or palatal aspect of the tooth. That will result in a physiologic reaction of the body. An enzyme will be released, which will melt away the periodontal ligament. What's holding a tooth? The periodontal ligament. The periodontal ligament is dissolved. That tooth will luxate up and out of the socket following that arc of rotation or that arc of the instrument itself. It's a very, very easy instrument to use. It's an easy instrument to perfect without squeezing the instrument. So saving your body, saving the patient, and allowing the patient to have a positive experience with extraction is amazing. I am excited to clinically evaluate and document this product in my practice for dentalunboxing.com. The beak, or the shovel-shaped edge, will engage the palatal aspect of the non-restorable tooth 1 to 3 millimeters subgingival. The bumper, which has a, you can see here, has a green sheathing, a soft cover on it, is not the working end of the instrument. Rather, it provides a fulcrum or a center of rotation for the instrument to atraumatically remove the tooth up and out of the socket. The instrument the beak will engage the palatal surface of that root, 1 to 3 millimeters subgingival. The bumper will be placed as high up the vestibule as possible, and without any force, we're not squeezing the handles, without any hand pressure, forearm, bicep, or shoulder pressure, we will create tension on that palatal aspect of the root. Creating tension will result in a physiologic response and a subsequent breakdown of the periodontal ligament, which will allow the tooth to disengage or luxate up and out of the socket following the arc of rotation of the instrument. There is no squeezing of the instrument, and in a matter of a few seconds, you will see the tooth will pop. You may not actually hear a pop, but you will see the tooth luxate up and out of the socket, actually maintaining that facial plate of bone quite effectively. Remember, you cannot remove the tooth with a lot of hand pressure. It is truly not a forceps in that respect. To remove the tooth in total, I will take what we call a tooth delivery instrument, a bird beak forceps, and I will simply rotate the tooth out of the socket in what I refer to as a atraumatic or minimally traumatic extraction technique. Hi, dentalunboxing.com subscribers. I'm Dr. Tim Kosinski, and I've completed my clinical evaluation of the physics forceps from Direct to Dental. So let's summarize some of the 5 main factors that I considered with this particular product. Did a product save me time? Unbelievably saving time. I think it's a wonderful tool that allows me to remove teeth quite efficiently and proficiently without a lot of trauma. I love the idea of atraumatic extractions or minimally traumatic extractions. And so I was able to use this instrument, and our patients would look up at me and say, "You're kidding, you're done? Wow." Because they didn't experience the negative connotations with our more conventional extraction techniques. I didn't grab onto a forceps and squeeze it. So in a matter of minutes, I'm removing even challenging teeth quite efficiently. So absolutely saved me a lot of time. Was it difficult or simple to incorporate in the practice? Well, I think there was a learning curve with the product. The beak is the working end of the instrument, and I needed to engage that 1 to 3 millimeters subgingival on the palatal or lingual aspect of a tooth. The bumper is not the working end of the instrument. It was simply a center of rotation, which allows me to create tension on the palatal or lingual aspect of the tooth and allows me to rotate the instrument following that arc of rotation of this precisely designed forceps or luxator, and that energy broke down the periodontal ligament, and so in a matter of minutes the tooth disengaged up and out of the socket, and then I just took what we call a tooth delivery instrument or a forceps and grabbed onto it, and I'm able to remove the tooth very atraumatically to the patient. Also, I was able to maintain the facial plate of bone very nicely, and I'm going to say it was really easy on me. I like saving my body. Because I didn't squeeze the instrument, and that's probably the hardest part of learning to use the instrument, is you're simply creating tension on the lingual or palatal aspect. So you're rotating your wrist rather than squeezing the instrument. And so there's no finger pressure, there's no hand pressure, there's no forearm, there's no bicep, there's no shoulder pressure. So it made removing teeth really simple. So I would say it's a wonderful product to have in your practice, and I would give it 1 being difficult, 5 being simple. I would give it a 5, no question. Product cost, I thought it was a very inexpensive set of 4 instruments, an upper right, upper anterior, upper left, and a lower universal instrument. I thought it's very cost effective. Again, time is of the essence in our practice, and being able to remove teeth where the patients have a positive experience, that's marketing. Allowing me to remove teeth without breaking root tips. I don't have to dig them, and removing teeth in a matter of minutes is a cost saving. So I think it's a very reasonably priced instrument, and I think it's something that I don't think I would practice without it again, to be honest with you. How does it compare to current techniques? Well, in the past, how did I remove teeth? I would take a periotome and go around the tooth. I would take some kind of luxator or elevator and kind of go mesial distal, try to rotate the tooth. I would take a forceps of some design, grab onto it, squeeze it as hard as I can, go mesial distal, figure 8, buccolingual, whatever, until we get that tooth out. But oftentimes root tips would break, and you'd spend a lot of times trying to find a root tip. We also have a myriad of instruments. You know, if I'm going to take a tooth out, my staff would bring a cart of instruments to me and lay it down. Okay, doc, what do you want to use? But now, if I'm going to take up an upper right, a molar tooth, I bring one instrument. Give me the upper right physics Forceps. So wonderful product. I think it is much better than anything I've ever used. It works very well in my hands. And when I purchased this instrument, no question about it. Again, it's something that will be in my practice for the rest of my career. I give the physics Forceps, our dental unboxit.com golden tooth, and would highly recommend it to any of my colleagues out there following my review of the product. And again, thank you for watching today, and please hit the subscribe button to get any more notification on future videos that we're posting. Thank you.